Healthier Together. Sponsored by Regents Blue Cross Blue Shield of Oregon.
Revamped COVID boosters have arrived in Oregon and Southwest Washington. They target both the original strain of the virus and the two Omicron subvariants causing the most infections right now.
But now we've got the kicker. So now we have M-spike protein for Omicron BA4 and BA5 variants.
And this year, doctors recommend a double dip, or I guess I should say double prick, for fall vaccinations, both the COVID booster and the flu vaccine.
And yes, it's okay to get both, just one in each arm.
Dr. Donna Milovitz is the executive medical director for Regents Blue Cross Blue Shield. She expects higher flu numbers this year.
So what's really interesting is for the past 2 years, our flu rates have been lower. And mostly that's because all of us have been masked. But now that the mask mandates have been lifted, we expect that we're going to see more flu or influenza this year. So this really is the year to get that influenza vaccine.
When it comes to a COVID booster, Pfizer's updated shot is available for anyone 12 and up. Moderna is for anyone 18 and older.
Just because you get a vaccine doesn't mean that you're not going to get the illness. It's not 100% protective. However, what it does do is it limits the severity of the illness as well as the risk of death. And that's across the board for all vaccines.
And it's not just the COVID booster and flu shot that parents need to think about.
First of all, it's really alarming. The dramatic decline in childhood immunizations that we've seen across the country. It's not just here in Oregon.
Milovitz says to contact your primary care physician or reach out to a trusted doctor to get you and your family caught up.
Really important infection control immunizations like diphtheria and measles and mumps.
Not only that, those checkups are also an opportunity to talk about things like behavioral health and developmental milestones to keep your kid on track. And annual checkups aren't just for kids. Grown-ups need wellness checks too. And you're not done with immunizations either.
So starting at the age of 50, thinking about the shingles shot, in addition to your influenza and your COVID booster. If you're at risk below the age of 65, the pneumonia vaccine is another one. And then remember, every decade you need your tetanus booster.
So Dr. Milovitz says get in touch with your primary care doctor and make sure you and your family are up to date on your shots to keep you and your community healthy.
And get in and talk about vaccinations. It's really important.
We have more resources for you to find a vaccination site and to learn more at kgw.com/healthiertogether.